see her notes, yeah, when she goes to her job and they're not up to scratch.
Lucy will literally cut my head off.
I will call her and say, hello, what does this mean? Hello?
Hi guys, welcome to my mom's YouTube channel. Today we're gonna do a school live routine. The first of it, we need to get our seatbelt. Coming, guys. Mommy's gonna drop me at my school and then she's gonna go work. She'll show you what it's like to do work. But me, I can't show you what I can do at school because you're not allowed to bring phones at school. Can you like, comment and subscribe?
Hi guys, welcome back to our channel. My channel.
No, it's not your channel, it's my channel.
My channel.
Okay, fine.
So yeah, as my daughter said, today we're doing a day in a life. It's my second to last day of placement, management placement. And yeah, so like in the morning, I come and drop my daughter at school. Breakfast club. And then yeah, I'm rushing to work.
And I want to show you what's in here. In here is money and a key. Like a key.
But yeah, so we'll continue the journey once I've dropped her at school.
Yeah.
So like, comment and subscribe.
But I'm not gonna be with you.
Yeah, talk to you later. Peace. Okay, so once I get to work, I'm literally, as you can see, sanitizing my desk, everything that we use, because we hot desk. You're never gonna have the same seat. And then I'm literally going online and having a look at my emails. Now, when you look at your emails, you would see what patients you're assigned to. We usually have about 3 to 4 patients that we see. However, because I'm a student, I usually have 2 patients. And then towards the end of my placement, I was then having 3. So you would have to look at your email, look at the patient and see where they live, what you're going in for, so you can plan your day. Okay, so to prepare for my patients, I usually print off their medication list, I print off their past medical history, I print off a GP summary, and then I also print off some documentation that I need, such as like forms such as your must, your Waterloo, pressure ulcer, things like that. Here's my practice assessor. And her name is Lucy. So she's a band 6. Can you introduce yourself? Band 6 specialist nurse.
You don't want me to do the
And your role.
Look, these men.
What do you do? How long have you been here for?
Understand the role.
She should really be a band 7. I don't know what she's still doing as band 6, to be honest.
I don't want to be band 7. Then I won't know left and right. So let me stay where I am. Wait, no, hold on. To understand the role.
But yeah, so she's like one of the most experienced nurses in the team. She's been there for a while.
Actually,
how long have you been there? You've been there for like
2 years. Anyway.
Yeah, 2 years, but she's very, very thorough. So that's why she's one of the best nurses in the team. I've learned a lot from her. This is my last week. I like my second to last day working with her. Do you feel sad? I'm gonna go.
I'm never having.
And you're gonna make me fly like a bird.
If I see her notes, yeah, when she goes to her job and they're not up to scratch,
Lucy will literally cut my head off.
I will call her and say, hello, what does this mean? Hello?
But yeah, it's been a really good time. The last 12 weeks working with her. I've learned a lot, like literally a lot. And it's made me confident as well, now having to be on my own and having no one to follow me around, shadow, and no one to like literally just be there and ask questions to. So yeah, and unfortunately, I lost my pad. So, guys, when I tell you that this is the worst thing that could ever happen to you, in my 3 years of studying, I have never ever lost my pad. But then in the last week of placement, I lost it, and it was my 12-week management placement. Story for another day.
I'm writing 12 weeks. 12 weeks of.
She's not having to do, so like I made like a temporary pad, I don't know if you can see it, but like literally like that, in a folder, and she's now having to like fill out all the stuff again. I feel sorry for her.
I can't even remember what I'm writing. Shadow the at-riskness and processes. What does the at-riskness do? What do you think your strengths are?
Strengths, I think, would be.
You need to
My
believe in
nursing
yourself.
assessment, maybe.
Okay.
But then obviously there's so much that comes in with nursing assessment, so I can't really say nursing assessment. You get, and also like building rapport with patients, making them feel comfortable, so I can feel comfortable to do my assessment, and also knowing my limits, my limitations, and knowing when I need to actually ask for help or clarify something.
Okay, so what do you think you need to develop? Because remember, the next step isn't you're going to be a nurse.
Yeah. The reason why I said confidence is only because if you've said something to me like once, twice, and like I should know it.
Okay.
So I don't know if it's still right to still keep asking, or then be confident in knowing that no, you know this already. Lucy's taught you this.
So remember, I always go that confidence comes with time and experience. Until you're out there by yourself and you're experiencing things, and then you're going to go, actually, I have had this experience before, so therefore I know what to do.
Okay, so as community nurses, you need to make sure you're always prepared, and you're not in a hospital where you've got all your PPE readily available to you, and so you need to prepare your bag. And so we've got our yellow bins where you can put our contaminated products in. We've got gloves, you've got your apron, you've got shoe covers that you need to have just in case if the patient wants you to have shoe covers on, you've got them available. Then you would have to put in some dressings. You never know what you would find when you get into a patient's house. Sometimes you might just see an unexpected wound which you need to cover, so you'd put things like your wound dressings in there. You'd have your barrier creams in. You would have your obvious equipment for observation, such as your blood pressure machine, SATS probe, temperature thermostats, things like that. Oh, and of course, enough pens. You don't want to run out. Okay, so at this point, I'm doing all my last minute checks. I'm calling my patient to let them know I'm on my way. I'm writing down any key safe numbers. You know, the thing with being a community nurse is you have to be very organized, because once you're out of the office, you're literally out. So yeah, making sure you've got everything before you leave the office, so you don't have to call a colleague to get the information for you. But yeah, we're finally off to go see our patients.
Why like this?
Blimey.
Guys, she just see what she just did.
Allow me.
Interesting. Getting our bag ready for her bag. It's always the student that carries the bag, by the way.
You're chatting shit. She's lying. Let me say that in a diplomatic way. She's lying. The student doesn't always hold the bag.
But every time you see a nurse, you always see the student carrying the stuff.
She chose
They
to
use
take
us.
it.
They use us as HCA.
She's not HCA. She's qualified nurse.
This one.
I'm tired.
It's not in this one.
No, go to the
What's the different here?
You have to.
Guys, yeah, we just looked up like how many flights of stairs I don't even know. But this is like the cons of community nursing. We're busy looking for a lift here.
I have to lift you.
So we came at the wrong blocks. Oh my god.
So block 3.
Yeah.
This is a madness.
First patient.
So what do you think of that visit?
Yeah, no, it was good. I mean, it was good the way that you were able to like sort of calm him down, because he was very irate when we got in. So even I was just, I had to bite my tongue because I wanted to be like, excuse me, because when you're shouting. We clearly can't do what you want.
See how he
us
apologized
to do.
at the end.
Yeah,
Which is nice.
Yeah.
But then this is what you're gonna get. A lot of patients are very frustrated, and as a nurse, you could either bite back or actually understand and listen. It's all about listening and say, okay, explaining it. They're not always gonna agree, but you actually supporting them and say, what do you need? Okay, I'm gonna do this. This is missing. I'll call you. Give them a name. Look. Another patient's called me. Do you understand? It gives them the confidence that they need. That's what nursing's about.
Guys, this is lunchtime. Literally on the go.
So you always have water.
Yeah. Guys, we're eating in the car. Driving to the next patient's house.
When you're working in the community, you learn to do techniques like
Drive and eat. But it's not healthy food.
it's not healthy food though. But I'm hungry.
Alright guys, so I'm off to see a patient. Should be a quick visit. It's literally to check her medications and to come up with a plan. So I'll let you know how it goes when we're done. So we just finished one patient and we're going across to the next one.
I can't see out the mirror.
Oh, sorry.
Where are we going? I don't know.
Shimoni Mona. Got her to have slips 4 times a day. Yeah. When I met her, I was like, she doesn't need the slips. She only needs the slips for night. So what I'm gonna do, I'm gonna change it to once a day.